record on the computer. There we go. Good afternoon. I just want to welcome everyone to our weekly Wednesday presentation on colorectal cancer. This presentation will be recorded and will be uploaded to the Otsego County Office for the Aging and New York Connects Facebook page and our county website. You can find it in the presentation library. I ask that everyone keep your videos turned off except for the presenter and myself, and that you remain muted. If you have questions during the presentation, please type them into the chat or raise your hand and we will get those answered for you. My name is Alicia Chase. I'm the Otsego County Long-Term Care Coordinator. I manage the New York Connects program as well as the Medicaid Personal Care Assistant program under the Department of Social Services. New York Connects is the connection to all long-term services and supports. And while our office is under Otsego County Office for the Aging, we are unique in that we are able to help anyone of any age who is looking for help navigating the complicated long-term care system. We can help friends, families, caregivers, and clients who are looking for information and assistance, referral and application assistance, or if you are just unsure of what to do, please do not hesitate to reach out to us. I will include my contact in the chat for anyone who wishes to reach out to myself or one of our intake specialists here at New York Connects. At this time, I'm going to turn the presentation over to Callie Reese with, what is your company?
Yeah, I'm with the Cancer Services Program. I do public education and community outreach.
Thank you.
Yes.
All right, go ahead.
Wonderful. Thank you so much for having us today. We really appreciate the opportunity to share a little bit about colon cancer. So our presentation is called Get the Facts About Colon Cancer. It's an opportunity to learn more about this disease, how to reduce your risk, and how you may be able to get free cancer screening through our program. So let's go ahead and get started. Colorectal cancer is also called colon cancer, and it is the second leading cause of cancer deaths among New Yorkers. Colon cancer is preventable, which is something I learned when I started this job, and I was astounded by. This is one of the reasons why it's one of my favorite things to talk about in my position. And screening tests can find colon cancer early when treatment works best. So a common question people have is what causes cancer? Cancer is a condition where abnormal cells grow out of control. These abnormal cells form masses known as tumors. While doctors don't fully understand what causes cancer, there are some things we know that can increase your risk or chance of cancer happening, and those things are known as risk factors. Some things that can increase risk for many cancers include getting older, race, and family history. So these three risk factors can't be controlled. However, the great news is that a healthy lifestyle can help to prevent cancer, and we'll talk a little bit more about that in a moment. So colon cancer is cancer that starts in the colon or rectum. Cancers are always named for the part of the body where they begin. It's most often found in the colon rather than the rectum. So most cases of colon cancer start as non-cancerous growths called polyps. And that's what these are right here. I'm not sure if you can see my cursor, but this is a flat polyp, and over here is a polyp with a stalk. So polyps usually take many years to become cancer, and this diagram shows what they look like, and that's what they're looking for when you have a colonoscopy, which I'll also speak more about in a minute. So next up, we're going to get a little bit of an anatomy lesson. So this picture shows where the colon is located in our bodies and what it looks like. The colon and the rectum are parts of the digestive tract. So food is digested in the stomach and small intestine, and then it moves to the colon. The colon absorbs water and waste leaves the body. So the colon is also known as the large intestine. Scientists know that risk factors increase a person's chance of getting this disease. Some things that increase risk for colon cancer include getting older, family history, and race. Depending on your race, you may have a higher or lower risk for colon cancer. For instance, African Americans have a higher risk of being diagnosed with and dying from colon cancer. So this is a health disparity. Personal history means having a condition that you've had in the past or right now. For example, things like inflammatory bowel disease, Crohn's disease, or polyps. And family history means that someone in your family, usually a close family member like a sibling, parent, or child, has a condition that they might have been born with or developed, things like Lynch syndrome or colorectal cancer. And if you have multiple second-degree relatives, like grandparents or cousins or aunts and uncles, that's definitely worth mentioning to your doctor as well. So most people who develop colon cancer don't have a family history of the disease. And risk factors like getting older, race, and family history, like we mentioned before, they can't be controlled. However, the great news is that a healthy lifestyle can help to prevent cancer. So it's important to see your doctor for regular checkups, eat healthy foods, avoid alcohol, get regular exercise, maintain a healthy weight, and not smoke. Oftentimes, there are no symptoms of early colon cancer. Polyps cannot be felt. A person could have colon cancer and not know it. But the symptoms listed here should always be checked out with your doctor because they could be related to colon cancer or to some other problem. So some of the listed symptoms include blood in or on the stool, and that could be caused by polyps or colon cancer, pain or cramps in the stomach that don't go away, changes in bowel habits that last more than a few days, and losing weight for no reason when you're not trying to. So as I mentioned, colon cancer may not cause any symptoms, and that's why screening is so important. So first of all, screening means checking for cancer before there are any problems. Screening is for people who feel fine. There are a number of ways to screen for colon cancer. The easiest and quickest way is with the take-home fecal test. The FOBT or FIT kit are stool-based tests done at home with a kit given to you by your healthcare provider. These can also be distributed by the Cancer Services Program. You return the test to your healthcare provider or a lab where they will check your stool sample for hidden or occult blood. And this is a test that should be done once a year. There's also the flexible sigmoidoscopy, which is not as common as the colonoscopy, but that allows your healthcare provider to check the rectum and lower part of the colon for polyps using a thin, flexible lighted tube. So it doesn't check the whole colon like a colonoscopy would. So here's a little bit more about the colonoscopy. It's like the flexible sigmoidoscopy, except a doctor uses a longer, thin, flexible lighted tube to check the whole colon for polyps or cancer. To prepare for the test, you have to follow a special diet and drink a special liquid that will clear out your colon so that the doctor can see clearly. During the test, the doctor can find and remove most polyps in some cancers. This test should be done once every 10 years or sooner based on the results. This is also the test that's done if a FIT kit or an FOBT kit show signs of blood. Oh, I'm so sorry. Here is the next slide. So these are some images of what those take-home kits look like, and they're really helpful. It's a great test for average risk individuals, and this shows some of the different brands, including the Cologuard kit. And people have the most success completing these kits when they review the instructions ahead of time and keep them in a convenient place in their bathroom. So if a fecal test comes back positive, the doctor will ask for further testing, which would usually be a colonoscopy. All men and women 50 to 74 should be screened for colon cancer. Some people may want to start screening earlier if they are at high risk, and that's definitely a conversation that you have with your provider. 93% of new colon cancer cases are diagnosed in those over age 50, which is why it's recommended to start screening at age 50. I know that a lot of people have had questions about COVID-19 and cancer screening, especially since many routine healthcare procedures were put off at the beginning of the pandemic. The National Cancer Institute estimates that there will be 10,000 excess cancer deaths over the next 10 years due to pandemic-related delays in cancer screening and treatment. And that's a pretty astounding figure. I'm happy to be able to report that at this point, with proper precautions, cancer screening can be done safely. Some of those precautions include things like wearing masks, increased sanitizing at healthcare facilities, social distancing at those facilities, and pre-screening for COVID symptoms. On top of that, for most men and women, colon cancer screening can be done in the safety of your own home. So that's another option for people. So you should talk with your healthcare provider to find out when is a good time to reschedule your colon cancer screening. 2/3 of cancers can be prevented with screening and a healthy lifestyle. So we're going to go over these ways to lower your risk for colon cancer again because they are so important. So you can drink less alcohol, get regular exercise, stay at a healthy weight, eat healthfully, and don't smoke, or if you do, quit. And most importantly, get screened for colon cancer. I usually like to take a pause here because big changes start with small steps. The little choices we make every day really do add up. So by choosing an apple or a handful of nuts instead of a bag of chips as a snack in the afternoon, you're improving your diet and you're improving your health. By taking a dance break during commercials, when you're watching your favorite show, that's another great way to get more active and improve your health. So talk with your doctor about what's right for you. Definitely, think about this in your daily routine and how you can work in some of these small changes to make a big impact. So remember, colon cancer screening is colon cancer prevention. All men and women 50 years and older should be screened for colon cancer. Take-home fecal tests are an easy and effective way to get screened for colon cancer, and the Cancer Services Program offers free colon cancer screening for eligible uninsured New York residents. I'm going to take a minute now to talk a little bit more about the Cancer Services Program, because in addition to free colon cancer screening, we also offer other free services. We offer free breast, cervical, and colon cancer screening and diagnostic services to uninsured and underinsured New Yorkers. You can check out our Facebook page for program updates and events. We have a lot of things going on, especially during awareness months, and we're always happy to share our messages. This is a little bit more information about the specific services our program offers. We can cover the cost of clinical breast exams, mammograms, pelvic exams, Pap tests, and HPV tests, as well as take-home colon cancer screening kits and colonoscopies for those at high risk for colon cancer. Diagnostic services are also covered through our program, and we have something called the Medicaid Cancer Treatment Program for those who are diagnosed with cancer who don't have insurance. It definitely offers some peace of mind when someone's going for their screening and doesn't have insurance. They know that they may be able to get this, free insurance program if necessary. We are able to offer our services at local clinical provider offices. So in our area, that includes Bassett and Fox facilities. And we're able to partner with Bassett's mobile screening coach for events throughout the region. So Bassett's mobile screening unit is an RV type medical coach that's equipped with registration area, exam room, and bathroom. It offers the same high-tech digital mammography provided at other Bassett and Fox facilities. So due to COVID-19, temperatures are taken prior to boarding the coach at your appointment time, and masks must be worn, just as the case with other clinics. And during these events, we do offer the take-home kits, and we provide those to anyone who's eligible. We have some upcoming events right in Otsego County. On January 11th, we'll be at the Southside Mall in Oneonta. And on January 19th, we'll be at Cherry Valley next to the post office. So if you know anyone who's due for their mammogram, we'd be happy to help. We also do the pelvic cancer screenings there and also colon cancer screening kits. So just don't hesitate to call and make an appointment. If someone's uninsured or underinsured, we can make sure that there's no out-of-pocket expense for them. And if they have insurance and are just in need of a mammogram or a pelvic exam, we can still assist and get them on this schedule. We would just bill their insurance. So if it's convenient for someone, we want to be able to help kind of reduce one more barrier to getting that screening done. So next up is our contact information. We are happy to help with information about the importance of cancer screening. We can do this one-on-one, in groups, and we are also happy to share information about our free screening services. So if anyone has any questions, don't hesitate to call us. Our number is 1-888-345-0225. And we so much appreciate the opportunity for having been able to present today. So do you have any questions for us, Alicia?
Do not, sorry, I was muted.
Okay.
I do not have any questions.
Yes.
People might ask questions as I post this to those sites, and if they do,
Okay.
I'll direct them back to you.
Yeah, that sounds wonderful. And I'll check the chat sections too, just to see if anything comes up. So thank you again.
Thank
And
you.
we really appreciate it.
No problem. Thanks for being here.
Thanks.